A bug crawled onto her face while she slept in Mexico. It fed on her for 20 minutes. She never woke up. The next morning, her left eye was swollen shut, purple, tight. She went to a clinic. They said spider bite. Gave her antihistamines. The swelling went away in 2 weeks. She forgot about it. 12 years later, her heart stopped on a sidewalk in San Antonio. No warning, no chest pain, no gradual decline. She dropped like someone had flipped a switch. And here's the part that should keep you up tonight. They restarted her heart. They found the damage. And the doctor told her that if anyone had known 12 years ago, a 60-day course of medication would have cured her completely. But nobody knew. And now her heart is destroyed. And there is nothing anyone can do about it. This is Diagnosis Glitch. Natalie Garza was 37 years old, immigration attorney in San Antonio, Texas. Rescue dog named Biscuit. Running shoes by the front door. 4 miles every morning before the sun came up. Same route, same podcast. She had not missed a day in 2 years. She scheduled everything. Court dates, dentist appointments, oil changes. But once a year, she did the opposite. Once a year, Natalie took a trip with no plan. Guatemala, Belize, Costa Rica. She liked places where the Wi-Fi was bad and the coffee was strong. She stayed in hostels and small guest houses with ceiling fans and cracked tile floors. She never booked more than 1 night in advance. Her sister Carmen was the opposite. Carmen booked resorts. Carmen wanted room service and a pool. Carmen did not eat food unless it came from a kitchen with a health inspection certificate on the wall. Every time Natalie showed her photos from a trip, Carmen said the same thing. "You're going to catch something in one of those places." Natalie always laughed. "You sound like Mom." Carmen was not joking, but she was a nurse in San Antonio. Nothing in her American training covered kissing bugs or a parasite called Trypanosoma cruzi. She knew enough to worry. She did not know enough to name what was coming. Remember who warned her, and remember who laughed it off. Because only one of them is going to walk out of the story with the same heart she walked in with. Natalie was 25 when she went to Oaxaca. She found a posada in a village outside of the city. 80 pesos a night, about $4 American. The kind of room Carmen would have looked at once and booked a hotel. Thick adobe walls, wooden beams across the ceiling, a courtyard with bougainvillea, and a dog that slept under the table. No air conditioning. She slept with the window cracked open because the room was warm and the breeze smelled like wood smoke. On her second night, she found a dark, flat bug on the wall near the headboard. She showed it to the owner of the Posada. He looked at it and waved his hand. "They're nothing. They've always been here. Everyone sleeps fine." She did not know that the cracks in the walls, the gaps around the window frame, and the space between the beams and the ceiling were not architectural charm. They were entry points. Triatomine bugs live in those cracks. They're called kissing bugs because they feed on your face. They are nocturnal. They're drawn to the carbon dioxide you exhale and the warmth of your skin while you sleep. They feed for 15 to 20 minutes. Their bite is painless. You do not wake up. The bug feeds until it's engorged. The meal is so large that it must defecate immediately right next to the open bite wound. Inside those feces is a parasite. It does not enter through the bite. It enters when you scratch, when you rub your eye in your sleep. When the feces contact any break in the skin, you push it in yourself without knowing, without waking. Natalie scratched her face sometime before dawn. The parasite entered through her left eye. The misdiagnosis. 1 week later, her left eye swelled shut. Massive, painless, purple. Her right eye was completely normal. She looked in the mirror and could not make sense of it. She walked to a pharmacia in town. The pharmacist said 2 words, allergic reaction. 2 days later, still swollen, she went to a clinic in Oaxaca City. The doctor examined her eye. He wrote in the chart, probable insect bite, localized allergic reaction. He prescribed antihistamines, follow-up in 7 days. He wrote spider bite, 2 words that would cost Natalie 12 years. He did not write Chagas. He did not test for it. That specific one-sided eye swelling has a name. It's called Romana's sign. It's one of the only visible markers of acute Chagas disease. And even in Mexico, where kissing bugs are endemic, it is mistaken for conjunctivitis, an allergic reaction, or a spider bite almost every time it appears. The sign resolves on its own in just 3 to 8 weeks. No matter what you do, no matter what anyone prescribes, the swelling just goes away. That is the window. That 3 to 8 week period when the swelling is still visible is one of the moments the disease can be caught and cured. A simple blood test, a 60-day course of anti-parasitic medication, the parasite is eliminated, the heart is never touched. Nobody ordered the blood test. The swelling went away. The parasite was already inside her. It entered through her eye, and it had no intention of leaving. Natalie told the story at dinner parties for years. I got some crazy spider bite in Mexico. My eye blew up like a golf ball. It was hilarious. Everyone laughed. Carmen did not. It became an anecdote, a funny travel story, a thing that happened once and never mattered again. The silence. 12 years passed. Natalie ran 4 miles every morning. She worked 60 hours a week. She adopted a dog. She scheduled oil changes and court dates and dentist appointments. She built a life that looked from every angle completely fine. The parasite did not care. 12 years after Oaxaca. A Tuesday in March. San Antonio was still cold at 6 in the morning. Natalie was on mile 3. Her feet hit the pavement the same way they had every morning for 2 years. And then they didn't. Her heart went into ventricular fibrillation. The muscles stopped pumping and started quivering. Blood stopped moving. Oxygen stopped reaching her brain. She collapsed on the sidewalk. A man walking his dog saw her fall. He called 911 and started chest compressions. Paramedics arrived in 7 minutes with a defibrillator. They shocked her heart back into rhythm. She woke up in University Hospital with tubes in her arm and Carmen sitting in the chair next to the bed, still in scrubs from her shift. What happened? Natalie asked. Carmen could not answer right away. The cardiologist ordered an echocardiogram. The image showed a heart that should not belong to a 37-year-old woman who ran every morning. The left ventricle was dilated, the pumping function was critically low, and at the bottom tip there was a thin-walled outward bulge, an aneurysm. Inside it, a blood clot had already begun to form. Your coronary arteries are clean, the cardiologist said. No blockages, no cholesterol buildup, no genetic markers. This is not standard heart failure. Something else did this. The first thought was myocarditis, an inflamed heart muscle, possibly viral. But the pattern was wrong. Viral myocarditis is diffuse. This damage was concentrated, targeted. The apical aneurysm was not random. It was a signature. Sarcoidosis was considered, autoimmune infiltration of the heart, but the imaging did not match. No granulomas, no lymph node involvement. She consulted infectious disease, and the ID physician asked a question that no doctor at 12 years had ever asked Natalie Garza. Have you ever spent extended time in Mexico or Central America? Natalie paused. I traveled a lot in my 20s. Oaxaca, Guatemala, Belize. Have you ever had unexplained swelling, particularly around one eye? The room changed. Yes, in Oaxaca, my left eye swelled shut for 2 weeks. They said it was a spider bite. The cardiologist looked at the echocardiogram. She looked back at Natalie. I do not think it was a spider bite. The blood test confirmed it. Chagas disease, caused by a parasite transmitted by kissing bugs. What 12 years of silence did. Here's what happened inside Natalie's body for 12 years while she slept and ran and worked and lived. Trypanosoma cruzi targets cardiac muscle cells. It tricks the cell into swallowing it. Once inside, it multiplies until the cell ruptures. Hundreds of new parasites pour into the bloodstream. They infect the next cell and the next. Her immune system fought back. It contained the infection. It kept her alive and feeling completely fine, but it could not kill the parasite entirely. And in the process of trying, her own immune system was attacking her heart tissue in the crossfire. The body's defense system slowly was destroying the organ it was trying to protect. Over 12 years, the muscle wall at the bottom of her left ventricle thinned. Scar tissue replaced living muscle. A weak point formed and ballooned outward, like a blister on the surface of her heart. People who grow up in villages where these bugs are endemic develop partial resistance through a lifetime of exposure. Their immune systems have encountered the parasite before. A visitor from Texas has never seen it. Her body had no defense prepared. Every other disease on this channel attacks you. This one just waits. It sits inside your heart for a decade and does nothing except make sure that by the time anyone notices, there's nothing left to save. The World Health Organization estimates 6 to 7 million people are infected right now. In Mexico alone, over 4 million carry it. In the United States, an estimated 300,000 people are living with Chagas disease today. Most of them do not know it. The acute phase lasts a few weeks. A mild fever, a swollen eye, then it resolves. The patient enters what doctors call the silent phase. No symptoms, no signs, for 10 years, 20 years, 30 years. Then the heart fails, or the esophagus stops working, or the colon dilates until it's no longer functioning. 30% of infected people develop chronic organ damage. The most common is cardiomyopathy, and the most common way it kills is sudden cardiac death. The first symptom for many patients is the last one. Antiparasitic drugs in chronic Chagas cardiomyopathy show only a 2 to 40% treatment response. The largest clinical trial ever conducted on this question confirmed that treating the infection at this stage does not stop the heart from deteriorating. The window closed 12 years ago, when the swelling was still there, when the blood test would have been simple, when the cure still worked. Carmen stood in the hallway outside the room, leaned against the wall, pressed both hands against her face. She's a nurse. She's seen heart failure. She's watched patients deteriorate in the ICU. But this was her sister. And the last thing that was destroying Carmen was not the diagnosis, it was the math. 12 years. If any doctor at any point had asked about travel history, if the clinic in Oaxaca had recognized the swelling, if anyone had ordered a blood test, a 60-day course of medication in her 20s would have eliminated the parasite with near certainty. Her heart would be untouched. Her life would be unchanged. But nobody asked. Nobody tested. Carmen walked into the room. Natalie was sitting up in bed, staring at nothing. "My eye was swollen for 2 weeks," Natalie said. All someone had to say was, "That is not a spider bite. Let us run a blood test." That is it. That's all it would have taken. She looked at her hands. "Now I have a machine in my chest that shocks my heart so it does not stop." Carmen sat down and took her sister's hand. She never brings it up. She never says she was right. She never will. The turn outward. Natalie knows what happened to her. That makes her the exception. Right now, 6 to 7 million people are carrying the parasite. 300,000 of them are in the United States. The kissing bug is not a Mexican problem. It lives in Texas, Arizona, Louisiana, New Mexico. It's been found inside homes in 28 states. A study published in January 2026 tested triatomine bugs near the US-Mexico border. 88.5% were carrying the parasite, up from 63% just 4 years earlier. In 2024, Mexico confirmed 779 cases of Chagas disease. The real number is almost certainly many times higher because most people who carry it will never know until their heart gives out. A documented case in the medical literature describes a 67-year-old woman whose blood donation was flagged for Chagas antibodies. When they asked about her history, she remembered developing sudden facial swelling at age 10 while camping in northern Mexico. She had carried the parasite for over 40 years. She had been donating blood for decades. Nobody had ever asked. If you ever have slept in a rural area of Mexico, Central America, or South America in a room with cracked walls or gaps around the windows, and you woke up with an unexplained swelling around one eye, go to a doctor and say these words: "I need to be tested for Chagas disease." It's a simple blood test. If it comes back positive and you're still in the early phase, the treatment works. 60 days, the parasite is gone, your heart stays yours. If you wait, if nobody asks, if the swelling goes away and becomes a funny story you tell at dinner, then one day, years from now, your heart may stop on a sidewalk, and the chart will say unknown cause. And nobody will ever connect it to a night in a Posada with cracked walls and a breeze that smelled like wood smoke. The scariest thing about this disease is not the bug, it's not the parasite, it's the silence. 2 sisters. One said, "You're going to catch something." One said, "You sound like mom." That was the only difference, and it took 12 years to matter. This is Diagnosis Glitch. I'll see you in the next waiting room.